The information provided in this podcast is for general knowledge and informational purposes only. It does not constitute medical advice. Always consult with a qualified healthcare professional for diagnosis and treatment of any medical condition. The views and opinions expressed by guests are their own and do not necessarily reflect the views of the Unplugged Healthcast or Dr. Wall.
If I was on a team of sports and I was coaching or playing and all my teammates were 4s out of 10 on wanting to win, you can imagine we would lose a lot of games. I'm asking you right now as you're listening, where are you at on helping yourself get out of this problem? See, if you're a 4 or a 5, you can imagine you're going to lose a lot of games. If I have a patient that's a 9 or a 10 out of helping me get them better, well, this is a lethal combination when it comes to killing your health problem.
Neck pain, backaches, headaches, fatigue, the list goes on, and you're likely on it. Tired of the broken system and big pharma? We offer logical solutions, teach you to think critically, and empower you to reclaim your health. Welcome to the Unplugged Healthcast with Dr. Kevin Wall.
Hey, welcome back to the Unplugged Healthcast. This is your host, Dr. Kevin Wall. We're in full swing of summer, heating up around here in Arizona. I don't know if you know, but Arizona is called the Grand Canyon State. Have you ever been to the Grand Canyon? Large hole, well worth your time. Check it out. Today, our topic is called the Grand Canyon of Healthcare. This is a strange concept, and you don't apply it often to healthcare or healthcare providers, but I talk about this to our teams all the time. If you understood how a patient thinks, you can always help figure out how to help them. Well, every single one of you come into every single doctor's office you've ever been to, and you have the Grand Canyon of healthcare. Here's what it looks like. You come in. Your real goal is to see that doctor one visit. And you'd really hope to pay 0 if possible. Do you see? This is the Grand Canyon of healthcare. There's a large gap between what you have and what it probably takes to fix what you want to get rid of. Well, I get it. I understand the thought you have because I have it. I'm just like you. I go to the doctor ever so often, the dentist, and I want a quick fix. I want in and out, and I want my health back as soon as possible. Of course, it's only logical you would want that. And a good provider wants to provide that for you. But sometimes the logic of that doesn't line up with the solution. But I get it. There's a lot of fear, a lot of skepticism, a lot of distrust. You don't have enough time. You don't have enough money. You've had bad experiences in the back. I get that there's a real reason you feel this way and act this way, but you also first have to admit this is a Grand Canyon of health. Because if you were overweight or out of shape, do you really think you can get your weight under control, your body back fit as a fiddle in a visit to the gym? We both know this doesn't make any sense, but I do understand where this comes from. In fact, I'm going to start this podcast off with a video from one of my favorite guys, maybe not always yours, but RFK's got a concept here that I need you to listen to because it helps set the table of why you choose this and why it makes sense to you. 1 visit, 0 copayment. Let's take a look.
A typical pediatrician's office makes about 50% of its funding comes from vaccines, not actually from selling the individual vaccines, from the traffic. I mean, when I was a kid, I went to the doctor when I needed stitches, and that's it. And today, every kid goes to the doctor at least 10 times to get their vaccines, and that foot traffic in and out of the office is a major part of the business plan for the pediatrician office. And they're also then rewarded by Blue Cross Blue Shield, which has a reward schedule for pediatricians who vaccinate 80 or 85% of the kids in their office. Get these giant bonuses, I think $40 or $400 per kid, huge amounts of money, hundreds of thousands of dollars that they make, making sure that 85% of the kids are vaccinated. And that's why they throw you out of the office if you fight back. It's not because they care so much about your particular kid. It's that you'll throw off the metrics and you'll lose them their bonuses. And so they, and those schedules have now been published so people can actually go look at the Blue Cross Blue Shield schedule and you can see what your pediatrician is making, and it's huge amounts of money from complying.
That's a sad story, really. This surely isn't the days of the Waltons, as I joked, or Little House on the Prairie, where you saw the doctor only if you had to, and he was honest, and ultimately you paid him in chicken eggs. Yeah, Blue Cross, insurance companies, the system is really broken. That's why this podcast exists, to unplug you from the system that has sucked you down this hole, to not only make you sick, but to really make you non-compliant. See, patient compliance is a massive problem when it comes to healthcare. In fact, I throw a lot of rocks at Big Pharma and the doctors, but today I'm actually going to toss a few in your direction. See, your inability to follow doctors' recommendations, to help the doctor, to be active, engage, follow through, keep appointments, do what they're asking of you, makes it pretty difficult for any doctor to actually really help you get better. But I get it after stories like that, after the fact that Big Pharma and Blue Cross are actually incentivizing your doctors to come back, pump your kids full of vaccines, and they incentivize them when you follow these programs. Well, today isn't really about vaccines. It isn't really about Blue Cross. It's about patient compliance. It's about helping you help the doctor get you better. Because I always said, if I was on a team of sports and I was coaching or playing and all my teammates were 4s out of 10 on wanting to win, you can imagine we would lose a lot of games. I asked all my patients for years and years and still today, how committed are you to helping yourself get out of this problem? From a 0 to 10 scale, where are you? I'm asking you right now as you're listening, where are you at on helping yourself get out of this problem? See, if you're a 4 or a 5, you can imagine you're going to lose a lot of games. If I have a patient that's a 9 or a 10 out of helping me get them better, I'm telling you, we win a lot of games. We get a lot of people better because when you engage with the doctor, you follow through. When you actually get the recommendations, you trust them, you follow them, and the doctor is trustworthy. Well, this is a lethal combination when it comes to killing your health problem and getting your health back. I'll tell you, for years and years, my favorite patients were patients you probably wouldn't have expected. And I don't mean to be racist by any means, because this is a good trait. I treated a lot of Hispanic patients for a lot of years. Man, were they great patients. And I thought about this for over the years. Why did I enjoy them? Why were they such great patients? Why did they get such great results in my clinic? And I can tell you, there is actually 4 main reasons that they actually got better every time, very consistently. Number 1, they trusted the doctor. They weren't beat down by the system like you are. Their kids weren't vaccinated 10 times. They weren't taught to go to the doctor all the time for every scratch and itch that they had. Actually, when they went to the doctor, it's because when they had a real problem, and they followed my recommendation. They trusted me. They followed the recommendation. They kept their appointments. And a crazy one, they paid in cash. Now that may seem is weird and why I would even bring that up. But here's the fact about people who pay in cash. They follow their money. Cash meant commitment. And when they chunked down money, they kept their appointments. They got out of it what they put into it. So I would encourage you that act that way when you go to the doctor. We're going to talk about the ways and the 5 characteristics of how you can get the most and overcome this Grand Canyon of healthcare. But I want you to remember this story right here, that compliance is a vital part of you getting results. I always said that I'll take a mediocre, average doctor who has great patient compliance over a doctor with bad bedside manner with a miracle cure, but his patients never follow through with any type of recommendation. See, the doctor who gets the patient to engage with them gets the most out of their treatment. So be a patient who gets the most out of your treatment. I get it. It's hard to know who to trust. It's hard to know who to follow. You've been beaten down by the system. You've been taking your kids or you've been taking yourself to the doctor for tons of treatment that really didn't do anything but probably made you sick. So why would you sign up for more of that? Well, that for sure is a problem. This mistrust, this massive skepticism, this I don't really want to do anything but avoid the doctors, I totally get that. I would feel the same way as you, and I still do. I often do. But to get over this canyon, the solution, here it comes. The first thing you have to understand is the concept of pain or symptoms. See, they are what we say the last thing to show and the first thing to go. Your pain doesn't really show up consistently at the beginning of your health problem as you may have been led to believe. The nupe it with Nuprin concepts where you actually think the pain is your problem is the first problem. See, toxins, traumas, life builds up on you. You accumulate injuries, bad diets, bad habits, stress. All this stuff slowly kind of wears down and beats you up, and you continue to ignore the first early signs, the sporadic soreness, the stiffness, the pain that comes and then goes away a day later. All these are just first signs and symptoms telling you something underlying is not probably there. You take ibuprofen, Advil just to kind of push it down and ignore it. But unfortunately, that stuff continues to accumulate. Typically, in the world of function, we say you are starting off in life functioning at 100%. But it actually takes, by science, almost a 60 to 70% decrease in function of any part of your body before your body finally says, I give up, throws his hands in the air and says, man, I got to get some help. This is when you get consistent symptoms. This is when you notice pain that doesn't really go away, starts to interfere with your lifestyle, starts to make it difficult to sleep or difficult to work. Your energy starts to go down. Your attitude starts to decline. You get a little short on the fuse. Your relationships are affected. See, this unfortunately is when you guys decide to see the doctor. And unfortunately, the horse is way out of the barn. If you aren't tired of my old Iowa farm boy analogies, this problem has been going on. The average time period that a patient presents in our clinics, and in most clinics, they will say the problem just started 2 to 3 weeks ago, and I can tell you it was probably 7 to 10 years ago. That's how long it takes for your body to get to a point where symptoms are consistent. Then your body is telling you, I need to get some help. All right, well, if you're willing to listen and understand that's just the truth, no one's convicting you more than trying to help you. If you are part of the solution, then you will get a solution. But if you think your health is like your car and you bring it into the doctor, drop it off and say, tell me when it's fixed and I'll come back and pick it up. See, this is not health care. That is auto mechanic care. And if you treat your body that way, you're not going to last. You're not going to get more than 30,000 miles out of your tires, I guarantee it.
Imagine a life where every movement doesn't come with a price tag of pain. At AFC, we don't just treat symptoms, we rebuild your confidence, one personalized treatment at a time. Our approach goes beyond temporary relief, targeting the root of your pain and helping you rediscover what your body can really do. Don't settle for surviving. Call us or visit our website today.
So to understand this concept, to get out of this problem, to overcome the Grand Canyon of healthcare, I broke it down into 5 different steps that you could take. If you follow these 5 steps, I guarantee you're going to live a healthier life. You're going to get the most out of the money and time you spend at the doctor, and you're going to start to gain trust again with your doctors. Because right now, I get it. I wouldn't trust anybody. You aren't trusting anybody. I wouldn't even expect you to trust me. I would expect me to earn your trust if you're coming to me as a patient. All right, but if we're going to get the most out of this, if we're going to fix this thing, here we go. The 5 things you have to do. First off, you have to understand your pain is not your problem. It is the last to show and will be the first thing to go away. As your body starts to get better, it finally says, oh, I can take a breath, and it'll stop yelling at you. Pain is like an iceberg. What you see at the top is unfortunately usually just the tip of the iceberg. So long-term change comes with short-term compliance. But what I mean by short-term isn't one good meal and expecting to lose weight, one good workout and expecting to get in shape, one visit to the dentist or the orthodontist and expecting your teeth to be straight. Thankfully, it doesn't take years to get your health back, but it often truly takes months of applying simple, logical, functional treatments and changes in your life, in your lifestyle, in your diet, in your therapies. If you understand the pain is the last to show and the first to go, you don't go to the doctor when you're in pain, and you don't stop going to the doctor when you feel better. If you trust the doctor and he has a treatment plan, you need to follow through. Short-term compliance, whatever it takes, go to the end, not till you feel a little better. That's just tipping off the iceberg. Okay, number 2, though, you have to choose doctors who you can trust. And that's hard, but here's some classic signs to help you understand that. Doctors you can trust do real tests. They come up with real results, and you can see them. You feel it when they test and find your problem, and you know they found it. There's things they do to document where you're at today, because if you start improving, there's a way to determine if you're getting better. Real doctors who you can trust don't say, trust me. Well, you just need to follow my recommendations. You just need to believe me. They use big words that you don't understand, and they keep you in the dark. They try to just use their diplomas and their degrees to overwhelm your logic and understanding. See, real doctors use real tests, and they speak the language that you can understand. You understand why you're bad, and you understand how you could get better. Real doctors can help you understand and teach and show you these things. That's the first thing you do when you choose the right doctor. That would be number 2 on our list of the top 5 ways to overcome the Grand Canyon of healthcare. After you've chosen the right doctor, he's done the right test. He's found the problem. It should be obvious to you he's found the problem. It should be logical to the problem that he found. The symptoms, the conditions that you have should line up with what he tells you is wrong. And then at some point, the doctor should be asking you the question that we ask every day in all of our clinics. Betty, we found the problem. Now it's up to you. How do you feel about the problem, and what do you want to do about it? Most doctors go straight into some big, high-level recommendation. Often it's overwhelming, doesn't make sense, and it seems costly. And it's for treatment you didn't even choose. See, you need to choose the care you want, but this has to be your choice. There really are the only 2 types of care when it comes to all health providers. There's what we call relief care, where you just treat it, patch it up till you feel better. Well, you can imagine what a patch does, kind of like on your roof. Patch your roof. Well, you still got a mess on the floor, and the roof rafters are rotted out, and the ceiling tiles are probably all bad. Well, patching things doesn't really fix things, but it does feel better. Correcting things is what most doctors who are functionally based are focused on. But that should be your choice. If you choose correction, then it should be your decision. The doctor should give you that choice. If you're just given a recommendation and you're held hostage to follow it, and you now are being told what to do, well, here's just the psychology if you haven't figured it out. People do what they want to do. They really don't do what they need to do. You do what you want to do, not what you need to do. So if you don't want to do the care, then I would recommend you don't even sign up for any of it. It just will never work. You're going to be that 4 out of 10 on the baseball team, and we're going to lose a lot of games, and then you're going to blame the doctor and the healthcare system. But really, it probably was you. You just weren't committed. You didn't choose the care, and you didn't follow through with the care. So number 3 is you have to choose to receive the care and not be told what the recommendation is and required to follow it. All right. Number 4, if you choose to get the problem corrected, if you choose, I'm going to correct the condition, not just want to patch it up, then you must give yourself the time and you must be part of the solution. You must engage in the treatment. You must be willing to modify some lifestyle, some habits, some hobbies. You must change what you do at home, because no matter what the doctor does in his 40-minute treatment at whatever clinic you go to, it will never overwhelm what you do at home. Your doctor should be giving you home exercises, home treatments, and often things like braces or home devices that can actually help you do things at home. Change your workstation, your computer station, your posture, whatever it is you're trying to get fixed. The good doctors will give you things you can do at home along the treatment, not as the treatment. Because just let's be honest, if you could do it at home, if this was a DIY health problem, you probably would have already fixed it. YouTube and WebMD would have already given you the answers and you would have solved it on your own. So be in the truth and the fact that you haven't been able to do that, you need to get the doctor on your team. Choose the recommendation and then follow the recommendations and be part of the solution.
Is chronic pain holding you back? At AFC, our team is committed to your well-being. We provide holistic care, including chiropractic, physical medicine, immunotherapy, detox programs, and more. Our experts target the root cause of your pain for lasting relief. Book your consultation online or by phone and experience our smooth process. AFC, embrace a life without pain.
Last and surely not least on the 5 things to overcome. If you've chosen the doctor, he's given a recommendation that you decided on, you're helping him at home. Well, here's the thing. The doctor must do re-exams. I can't even tell you how many patients over the 30 years that I have seen, they've seen these doctors for years. And I ask, well, when's the last time he did a re-exam or a re-x-ray or rechecked your blood work or rechecked whatever test they maybe did in the initial time? Well, the first thing I find out is they didn't do any testing. There was just, he checked you, put his hands on you, looked at you, gave you a prescription or a recommendation, and there really was no definition of what was wrong. So why would he re-examine you? How would he re-examine you? There's nothing to re-examine. But a good doctor re-examines you. And he retests the same test he did when you came in, and he should be able to show one of 3 things. You're getting better, you're staying the same, or you're getting worse. The only thing that would change the treatment in the first re-exam in our offices is if you're getting worse. Well, we're then going to modify the treatment, do some further testing, or refer you out. If you're staying the same, we still may stay on care, modify some minor things, and keep at it for maybe one more treatment regimen until the next re-exam. And if you're getting better, we should know how much better you are, because there's going to be a beginning, a middle, and an end to your treatment. Every good doctor has a beginning, middle, and an end. You should know when you're done, and you should have a good estimate of how long it'll take for you to get there. If he's not re-examining throughout the process, how in the heck would he know where you're at? How would you know if you're getting better, and how would you know when you're done? This is why many patients never get on a treatment plan, never follow a treatment plan, and never finish a treatment plan. First off, the doctor didn't have a plan, didn't do any testing, and he surely didn't re-examine you through the process to determine if you were getting better, if he needed to stop, if he needed to refer, and when you were done. See, good doctors do that. If you and the doctors followed these 5 recommendations, these things throughout your treatment plan, I guarantee you're going to either get great results or you're at least not going to waste a lot of time. But if you decide I'm just doing patch care, I just want one visit, pay 0 co-payments, well, I can tell you that's a perfect solution to chronic illness. It's one of the reasons America is so sick today. We've got so brainwashed with the concept that quick fix is the answer. I can go in today, get my health back tomorrow. I can just ignore, do nothing, go in, get a drug, get a medication, get my health back. Come on, guys, this makes no logical sense to anybody. In fact, if I was a doctor and I told you after finding out your problem was a 10-year-old problem and we saw x-rays that your spine was degenerating and your posture was 30 degrees off center and you've been dealing with a multitude of health problems, and I said, hey, let's treat you one time and fix this problem, you would think I'm crazy. See, there is no logic. So I'm not trying to give you a lecture. I'm just trying to encourage you that if you want your health back, you would not let the Grand Canyon of healthcare stop you. In fact, you would probably just go around it and understand that it takes time. It takes good doctors, but it takes good patients. Be a good patient. Follow through. Help the doctor. If you do, I guarantee you're going to get different results than you've ever got before. If you're ever looking for a good doctor, I have a lot of people reach out to me, listeners, people on our podcast, patients and friends, and they're just looking for a good doctor in their area. I'm more than happy to help you find one. Not that I would say I know them personally, but I know what to look for. These 5 things I said are easy ways to find out, but sometimes it's still confusing. Go on my drkevinwall.com, leave us a message, follow us if you will on these podcasts. And you can get answers like this, and I'm willing to help you find the good doctors and work your way over the Grand Canyon. Hey, we're going to wrap up our podcast today by answering a few questions from a few callers and people that have written in. I got Bob over here, and Bob's having what he calls bilateral carpal tunnel syndrome. He's a little skeptical and doesn't want to get surgery on both of his wrists, and he's wondering, are there other solutions? Well, Bob, I'm with you. I'm pretty skeptical myself, because it's pretty difficult to get the same exact problem in 2 different parts of your body from what they call repetitive activity. That's usually what they tell people they have, and what was the cause of their bilateral carpal tunnel is, well, you're using your hands too much. Well, the odds of using them exactly the same is almost 0. Chances are you're going to be right hand dominant. You're going to use one side much more than the other. So when you're seeing symptoms on both sides of your body, especially like bilateral carpal tunnel, then I can probably tell you have a midline problem. The only spot where both of your hands are connected is right at the base of your neck. Most people who sit at a desk have lower neck problems because their head is shifted forward. That will pinch the nerves, go into your hands, and you will get bilateral carpal tunnel symptoms. Your wrists will hurt, your wrists will get tight, your wrists will get numb, your wrists will swell. But the odds of you having the same thing on both hands at the same exact time is almost impossible. I'm telling you, you have one problem, and it's probably at the base of your neck. So if you would actually change your computer, lay on a good pillow, stretch your neck over what we call a posture pump or a Dakota wedge, which actually starts to put the curve back in your neck. If you could just get your anterior head posture shifted back to normal, shift your posture, shift your head position, get massaged, get adjusted, see a good chiropractor, and I can tell you, you're going to get rid of both hand problems with one solution and no surgery. I hate that surgery. Cuts your wrist open, leaves you without a wristband, a tendon that holds all the bones together. Not for me. I'm telling you, there's better solutions out there. All right, we have Nikki, and she says, hey, I have an upper back sore spot, and I'm now getting migraines every day. I used to just get some headaches, and then I started getting migraines, and now they're almost every day. It seems like my upper back and my migraines they come together, but I've been to like 3 different chiropractors. In fact, I went to a chiropractor who only treated the upper spot in my neck. I'm so sorry you're dealing with this because that is really bad. Migraines are debilitating. I see so many people having those. They just take high-level drugs and never get it solved. If you're noticing that your upper back, your shoulder region, is sore, stiff, or tight consistently, and you're getting migraines with or even without that connecting, but most time they do run hand in hand. Again, this is almost the same problem that causes that bilateral carpal tunnel. In fact, I'll bet if you really notice, you often notice you have pain into your arms and your hands also. Most people have that thing. There unfortunately are some chiropractors that don't shoot x-rays and some chiropractors that maybe don't have the training to treat certain different parts of your body. Well, like a good mechanic, a good plumber, or a good movie, there's good and bad in all professions. Just because one doctor didn't help you doesn't mean you write off the whole profession. So I would suggest you find a chiropractor or a doctor who understands upper thoracic, lower cervical problems. The problem's going to come where your upper back is mostly twisted or torqued, often from repetitive activities. Softball, pickleball, tennis, we see that happen a lot where you're swinging a club, golf, you're swinging a club in the same direction all the time. That repetitive, redundant twisting of your spine, or maybe it's what you're doing at work even. You repeatedly have your computer turned to the left. Repetitive activities like that often torque or twist your spine or your shoulder girdles. This starts to impinge the nerve roots. Those upper nerve roots in your back go up into your head and control the blood supply to your meninges, which are the blood vessels around your brain. So when you mess with your upper back, it shifts the blood supply, and these are going to create vascular headaches. Well, guess what the number one vascular headache is? It's a migraine. No one would think this is actually coming from your upper back, but pay attention. If you have migraines, you often have upper back pain, right below your neck, above your shoulder blades. That is not a coincidence. That is most likely the cause of your migraines, and for sure, probably your carpal tunnel bilateral. All right, guys, well, there you go. There's a couple problems that maybe you can relate to and recommend others to get solutions from, but minimally today, I'm hoping that you would just not let the Grand Canyon of healthcare stop you from getting your health back. All right, well, this is Dr. Wall. Check us out online at theunpluggedhealthcast.com. Share these episodes with others if you will, and join us again on another episode of the Unplugged Healthcast. This is Dr. Wall. Always remember, be healthy, be blessed, never give up, and never give in. We'll see you soon.